I think if you don't want to vaccinate, don't bring your kid to me. I don't want the moral. I don't want to worry about
Mhm.
it, okay? But there's a flip side, which is what if you really are an Orthodox Jew and you live in an Orthodox neighborhood in the Bronx and 80% of that community doesn't vaccinate the kids until before they go to school? So you're just going to send all those kids in the emergency room because you're going to be, I couldn't practice like that, but I'm just saying there are good people who have poor quality measures
Mhm.
because they're not reaching the target vaccination rate for their state,
Mhm.
but they're in a community that does not accept that.
Yeah, and
And they're
people
trying to do the best they can and they're
sure.
being penalized. So what is the solution? Deny all those kids care? Just send them to
So
the ER?
that's a social determinant of health, right?
Mhm.
So that's the other piece that is missing in value-based care is how do you measure social determinants of health and take those into account so that you can modify your expectations of a provider and their success? Because the population you serve and all of the external factors that affect that patient's healthcare, whether it's a religious issue, whether it's access to transportation, whether it's whatever that social
Mental
determinant of health
illness,
is. Yeah.
mental
Yes.
illness, drug
Yeah.
addiction.
Employability,
Yeah,
financial insecurity, all
yeah,
of those
yeah.
things affect the success of the physician. No matter what we do as a practice, there's going to be a limit to what we're able to overcome, even if we put a lot of resources into it. And it costs more to do that, right? So that's why this is so hard because the value is not simply shared savings, period, or hit this quality measure, or this is going to average out of that was my when we were in a medical home program prior to our value based or our ACO contract, they were telling us that our percent of prescriptions for branded pharmaceuticals was too high. And so we weren't going to get our award. And we were doing all of our own asthma care and we were actually diagnosing kids and controlling their asthma. And so our asthma rates were through the roof as far as quality, and we were saving a ton of money. And kids were not going to the emergency room. Kids were not going on inhaled steroids. We have a lot of asthma in Nebraska, a lot of allergies. And the people who were not treating the asthma looked like all they ever prescribed was amoxicillin, right? But we were prescribing every single month Flovent. So we're doing a better job of managing the patients, but we weren't hitting. And the pharmacy executive said that would average out. The reality is you have enough patients that you shouldn't be any different than the average pediatrician, and they don't get it. So that is a problem with having metrics that you meet. But you have to look at. There's got to be a way to do it, okay? Because the
Okay,
actuaries,
so
all kinds of crazy stuff. The problem
we'll
is
get there.
the
We'll get there.
actuaries work for the insurance company.
So not necessarily, but we'll get there. We'll get
We have actuaries with our ACO, and that's one of the reasons why we're so successful. But a tiny little practice on their own is not going to have the ability to do that.
no. But I'm going to use examples to go through how not the actuaries, but the healthcare economists look at these
Yeah.
issues. And Dr. McQueen just blew it just blew me away. He said, some of the questions that you're asking are not economic questions,
Yeah.
they're ethical questions. And so I'm going to give you an example of an ethical question. Should every child born in the US have access to vaccines? That's an ethical question.
Absolutely.
It's not an economic question, it's an ethical question. Should every child in the US have access to free K through 12 education? That's an ethical question. You could argue and shoot yourself in the foot that's not necessary. It will destroy the democracy. But that's my opinion and my ethics. I think they should. Okay.
But the economic question is what is the economic impact of every child being vaccinated?
And what is the economic impact of children being
Right.
literate?
Right.
Okay.
Yeah.
Yes. But he said some of these questions that you're asking her are ethical questions.
Mhm.
The first thing society has to decide for itself
Mhm.
what it wants to look like and then figure out how it gets paid.
Mhm.
So when we talk about value, which is cost savings for the purpose of this example, the polio vaccine has no value because we don't see
But that's
polio
not how
anymore.
I define that.
Right. It has no value because we have zero spent, thank God, on paralytic cases of polio in the US because everybody gets vaccinated. And the last time we really saw deaths from polio were in the 1950s before the vaccine became widely available. And anybody that denies that, says it doesn't work, is Looney Tunes.
Mhm.
Okay. However, you cannot put a monetary value to the peace of mind that mothers across America have every summer when they send their kids to the pool and they know they're not going to come back paralyzed.